Hormone therapy. There's an elephant in the room, and it's been there for a long time and it needs to be dealt with. Hormone therapy, or HT, has been used to relieve many of the symptoms associated with menopause for the past 70 years. It dramatically improves the quality of life for many women who suffer from uncomfortable symptoms like hot flashes and night sweats. But 15 years ago, in spite of the benefits, women started to rip up their prescriptions, and physicians, they stopped prescribing. That's because in 2002, the Women's Health Initiative, commonly called WHI, released a study that looked at the long-term effects of hormone therapy in older, asymptomatic menopausal women. In the preliminary analysis, it reported that HT did not lower a woman's risk of heart disease, as originally described in younger menopausal women, but instead it increased her risk of blood clotting, stroke, and breast cancer. The controversy that erupted from the study rippled for many years and discouraged an entire generation of healthcare professionals from recommending HT and menopausal women from asking about it. In fact, 5 years after the study, the use of HT declined dramatically, and yet there really were no effective alternatives to replace it for treating menopausal symptoms. The adverse consequences of these decisions on women's bone health, quality of life, among others, is now well established. Yet menopause and the impact it has on women's health did not go away. Let's start talking about it again now. A lot has changed since the WHI study first appeared. Some of the key findings have been called into question, and subsequent research has come forward to suggest that the participants' age mix led to some of the more misleading conclusions. So, today we can say MHT is safe in the appropriate population, and it is still the most effective treatment for vasomotor symptoms and the genitourinary syndrome of menopause. We also know that women suffer less bone loss and fracture when they're on HT. They often report an improved sex life and overall improvement in their daily living. And there are other benefits. Women who start HT within 10 years of menopause do have a reduced risk of heart disease and a reduced risk of dying from any cause. The numbers we are talking about are not small. The studies show a 40% or greater risk reduction. Breast cancer, well, it does remain a concern for all women, and it is a common cancer among the age group of women in menopause. But it is important to keep the risk in perspective. Women who have not had a term pregnancy before they turn 30 run the same risk in terms of the risk that comes after 5 years of combination continuous estrogen and progestin therapy. Women who take estrogen alone do not show this increased risk. That 5-year limit of HT use is another persistent myth. The decision to take HT is an individual one. It needs to be based on an informed discussion between a woman and her healthcare provider about the individual risks and benefits. All practice guidelines recommend an appropriate dose for the appropriate symptoms for the appropriate length of time for the woman without talk of an arbitrary stop date. We have an important role to play in responding to the needs of women who place their confidence in our knowledge and our clinical experience. For perimenopausal and menopausal women, there's a gap between what we know and what we do. A recent study found that only 49% of gynecologists would prescribe HT to their patients and also recommend non-hormonal options to about 87%. Yet 84% of these same doctors would use HT for themselves or prescribe it for their partner, their friends, or their family, suggesting that healthcare professionals who are most in touch with the body of research out there and have years of hands-on clinical practice know that HT is safe. It's time to address the elephant head on. For most healthy symptomatic women under 60 years of age and who have been in menopause for less than 10 years, hormone therapy represents the best and safest option available for the relief of disruptive menopausal symptoms and improvement in quality of life. Women need to know this. They need to know that while we are not prescribing HT to prevent disease such as cardiovascular or neurological diseases, the evidence is there that for many women, it will. We know that public opinion is hard to change. Doubt and fear, really hard to sway. But it's our job to share what we know, especially when our behavior shows that we don't have the same doubts or fears about HT as our patients do. It's time to myth bust HT and combat the misperceptions and misconceptions that are still circulating about its use. This will be a challenge for years to come, but we need to be talking about what we know, and the best time to start talking is right now.